The first step exercise for stability of your pelvis, which is the house where your pelvic floor is the floor up, is actually very simple. We all did this at about 3 months of age. So lay down on the floor. This is called toe tapping. So you lay down on the floor and bring your arms up. By bringing your arms up, you are challenging your rib cage to stay put and stay relaxed and not lifting up, creating this gap. So that gap is closed, your arm is opened up. If your arms or your forearms don't touch the floor, you can bring something and put it under it to lift it up. If that's still uncomfortable, you can just leave them on your chest. But the key here is to work towards that ultimate goal. You want to make sure the arch in the small of your back is closed, and so your pelvis is therefore not tilted forward or excessively backward. Your neck is nicely elongated. You bring one foot up. The key here is to fill in this barrel with biological breathing in. I've done a video on biological breathing. We're going to make sure that we put it at the end of this video, and then we bring the other leg up. So what we don't want to do is by lifting this, the body moves down because it was not stable enough to begin with. The stability of your trunk should not rely on the lower extremities or upper extremities. In other words, if you did not have any legs or arms, you should be able to have full stable trunk. Unfortunately, with pelvic floor dysfunction specifically, as well as other conditions, that is not the case. So this exercise is to bring that right in. A lot of times patients want to skip things and go into more advanced exercises, which are not really difficult. The issue here is when you don't have the preliminary and basic exercise or basic foundation, then those are not going to last. Make sure you invest your time on building a strong foundation, which this exercise is, and work your way up. This channel is all about stability of the pelvis. So if you have not subscribed to the channel, make sure you do. I'm Dr. Shakib, by the way, from Core Pelvic Floor Therapy in Irvine, California. For those of you who are from other states or other countries, we do provide coaching. And for those of you who are watching, you can always follow us on social media to learn bits and pieces of info we find to be necessary for at least our patients and their treatments. Thanks for subscribing.